Today we're going to talk about a collection of activities that are meant to not only challenge your mind, but offer an opportunity just to share our opinions and our thoughts. Hi, I'm Dan Stewart. I'm from St. Louis University's Geriatric Workforce Enhancement Program. And today we're going to talk about Individualized Cognitive Stimulation Therapy, or iCST. This is an individualized approach to cognitive stimulation for people with mild to moderate dementia. But what makes this program unique is not only the key principles behind it, but also that it really focuses on fostering a relationship between the participant and the facilitator. This video is sponsored by funding from the Health Resources and Services Administration through the Geriatric Workforce Enhancement Program. When we talk about dementia treatment, we often think in terms of a medicalized approach, and this is what it's been historically. We think in terms of assessment, diagnosis, treatment from a medical perspective. And it really isn't until the 1990s that we start to see a shift where we begin to focus on the person and their environment, their relationships, a more holistic view of a person with dementia. And in the 1990s, we see the creators of CST come out with a seminal work talking about the differences and the importance of non-pharmacological interventions for dementia. Often in this medical perspective, we treat with medications. But as we see with many individuals with dementia, some people don't respond well to medications, or perhaps there are other options. So what the creators of iCST, Spector, Oral, and Woods saw that there was a need and a gap in what was available for individuals with dementia. Looking and finding in available literature, they found what were the most effective measures of non-pharmacological intervention. And from there, they were able to create a comprehensive program known as cognitive stimulation therapy. And that has transferred into what we know today as CST as well as iCST. In front of you, you'll see three manuals. The first intervention came out in 2006. The first manual, our blue manual, Making a Difference, is really focusing on the group intervention of group CST, group cognitive stimulation therapy. Its follow-up in 2011 is an extension of that program, and in 2014 is where we reach our green manual, our Making a Difference 3 for individualized cognitive stimulation therapy. What makes this program unique is that it's very evidence-based. Using randomized controlled trials as well as qualitative studies, the creators of iCST have been able to show that this intervention not only improves cognition, but also improves quality of life and socializations. And what has led to a series of studies over the last 10 years or so that this intervention has been available, have come to find out that iCST, CST is so effective that in the UK, where this intervention comes from, it is the only non-pharmacologic intervention for dementia that is validated and supported by their government. So when we look at iCST and what makes it unique is that it's very individualized. It's a one-on-one intervention derived from evidence-based practices that are meant to be given in a very structured way based on themed activities between a caregiver and the care recipient.
We're going to do exercise 44.
Right.
It's about art, and we're going to be looking at these different pictures and getting your opinion about the pictures.
Unlike the group intervention, the cognitive stimulation therapy, the individual cognitive stimulation therapy really focuses on fostering the relationship. So not only are you getting the effects and the benefit of the group CST, in which you're having stimulating activities and personalized approach, you're also being able to create an environment in which the facilitator and the recipient are able really to delve into that relationship together. So who is iCST designed for? Well, initially the intervention was created for caregivers and their care recipients, but also it can be for individuals who no longer enjoy a group setting or perhaps never enjoyed group settings from the get-go. Also for individuals who perhaps have done the group CST intervention and have reached a place in their dementia diagnosis that they're no longer appropriate or feel comfortable in a large setting. iCST is very structured in its delivery and as well as its curriculum. Typically delivered by a relative, a healthcare professional, iCST is done within a 30-minute session, 3 times a week, over the period of 25 weeks. Again, recognizing the individual approach, this can also be manipulated and changed as suited for your needs. Each actual theme within the activity book covers a variety of activities that really can be suited for your needs and the needs of your participant. Each session follows the same structure. When working with people with dementia, it's often important to provide consistency. As we provide consistency, we're able to decrease anxiety and provide for optimal learning.
And I'll be taking care of business every day, taking care of business every way. I've been taking care of business, it's all mine, taking care of business and working overtime. Work out!
Okay, here we go.
Each session follows an introduction, a main activity, and a closure. The first part of the session is the introduction, typically around 5 minutes. During this, we're providing a welcome to the participant, really starting that conversation and making them feel comfortable, as well as adding implicit orientation, really orienting them to the time, date, and place. This is really a time to come together and really foster that relationship and a nice, welcoming space. After the introduction, you'll read a current events article together, again, lasting about 5 minutes. This current news article can come from local newspapers to national newspapers. Here you'll read a story together and discuss it in terms of opinions and what you think. So after your introduction and your current affairs news article, you'll move to the main activity as outlined in the Making a Difference 3 manual. The main activity can follow a variety of topics, anything from art to family history to foods, whatever works best for you. Within the manual, you'll have an outlined activity set up with level A and level B, level B being a little bit more difficult than level A. And this activity is really set as a way to provide a cognitive challenge, but also enable that conversation to flow. Really talking about the opinions. Why did you come up with an answer?
Take off.
It does, yeah.
No, I knew that. I don't think it will, though.
No, I hope not.
iCST really focuses on the importance of opinions over facts and really validating the person with dementia so that they feel comfortable enough to share those opinions and facts rather than be quizzed. Finally, once you're done with your introduction, your current events, and your main activity, you'll have a moment of closure. During this moment of closure, you can review what you talked about, perhaps print and hand out the news article that you discussed, and really highlight when you'll come together again. Always thanking the participant for coming, and again, fostering that relationship before the end of each session. Like CST, iCST really roots itself in multiple key principles that are really crucial in providing a fulfilling and evidence-based practice. These key principles focus on things such as mental stimulation, really focusing on new ideas, thoughts, and associations, opinions over facts, being person-centered, and really building and strengthening relationships. These key principles are crucial for best understanding iCST, its importance, and how to have the best intervention possible. While we do recommend following the structure that is outlined in the manual of iCST, we do recognize the importance of person-centered care. Therefore, if there's anything that you need to change or manipulate that works best for you and your client, the creators of this manual recommend that you do so. That really is a key feature of iCST, and what makes it unique is that we really recognize the importance of the individual and their care needs.
They had some interesting buildings up in Seattle, that's for sure.
When you're getting ready to start a session, it's important to consider what time of day. When is best for you? When is best for your participant? When is that optimal time for learning? And really focusing less on making sure that your participant understands what is the correct answer, but rather that they feel comfortable and validated in their opinions and have a space to share them. After you've designated a time for iCST and a place, really prepare yourself for these sessions. Perhaps provide a light snack or water before you begin. Again, we're fostering an environment in which individuals feel comfortable to chat and to come to you to feel welcomed and validated in their opinions, as well as having a little bit of a mental exercise along the way. Hints for working with the individual. Really focus on avoid correcting. Allow for error in the sessions. Do not ask direct questions, such as, do you remember? Adapt the sessions to the person's interest and personality. Avoid asking questions that involve that explicit memory. Really focus in on that person's strengths and then again offer an alternative activity if the first one does not work. iCST really truly values individualized approach. When we're working as caregivers, as healthcare professionals, we're offered a unique opportunity through this intervention to not only get to know our participant, but to validate them. What this intervention really relies on is recognizing the personhood of the person with dementia. I hope you found this video helpful in better understanding individual cognitive stimulation therapy and what it can do for you. For more information, check our website out at aging.slu.edu. Thank you.